Okay, so let's move on to our fourth and final theme that we have in common, which is taking a trauma-sensitive approach
Mm-hmm.
and lens in how we support our clients and patients for you. I had never worked with a chiropractor before you who had this approach. Hopefully, there's more who are being trained now,
Definitely. Yeah.
which you talked about there are, but I think it's so unique, but so needed and so important. So let's talk about our perspectives. Um, First of all, I want to also say content warning, maybe trigger warning for
Yeah.
anyone who is still working through trauma and it's very present for them. This may not be the topic to listen to right now, or take care of yourself if you are. So with that being said, I think it could be helpful to like define what we're talking about when we say trauma first.
Yes.
And I know you'll have examples as well. And I think that will be helpful just for people to hear both of our perspectives and examples of trauma. So we often think about big T traumas: war, car accident, abuse, abandonment, sexual betrayal, things like that. Valid and real trauma.
Mm-hmm.
Also valid and real trauma are the little t traumas or everyday traumas or developmental traumas, where we weren't seen for who we were, or weren't allowed to be who we were, or didn't feel like our needs were met, physical or emotional needs. And I've heard it described too that trauma isn't what happens to us,
Mm-hmm.
but it's what we make of it. It's how we make sense of what happens to us and how we internalize it. And then from that place, how we learn to disconnect from ourselves because it feels safer.
Right.
But that disconnection is an abandonment, really, of ourselves, and that creates the additional trauma. So some examples, and oftentimes trauma, is in childhood when it really makes an imprint on us and
Mm-hmm.
on our nervous systems. And so some examples of everyday trauma: being bullied at school, being home alone, being like a latchkey kid,
Mm-hmm.
having authoritarian parenting style where, it wasn't okay to be in conflict or to negotiate through conflict or to have our voice heard. And so how do we make sense of that? Like, what do we tell ourselves when we experience those everyday types of trauma? And it's, either like, we're not okay as we are, my needs don't matter, my voice isn't valued. And then that is the place where, we bring that trauma and that experience and that story with us to present day, and it affects our behavior today and
Mm-hmm.
how we show up for ourselves and how we take care of ourselves.
Exactly. Yeah.
Yeah.
And also, just to piggyback a little bit on that, like I had a big aha moment when I started looking into trauma, and especially as a child, right? If your caregiver was the one that wasn't meeting your needs, or was the one that was like authoritative as a child trying to establish safety, you're not going to make your caregiver, the person who's putting food on the table, wrong. You're going to internalize it and be like, I'm wrong, right? There's something wrong with me. I'm bad. And I get just like chills saying that right now, because I see how this manifests in then the languaging that I witness people share. And I think that I started really observing this early on in my practice and started to really dive into being a trauma sensitive and informed provider. Because again, it's like trauma manifests in the body. Like there's always some sort of somatic piece to it, because again, our beautiful, amazing, intelligent body is always going to protect us and try to keep us safe. And I have the privilege of being, having a hands-on approach to working with people. So it became essential for me to understand how that shows up, how I want to show up for people, and how to hold space when we start kind of unpacking that a little bit. And then also knowing the appropriate places and teams to have to refer when people need more support.
Exactly. Yeah, I love that you mentioned when your primary caretaker was not available to you or neglectful, and you don't choose yourself over them, you choose them, and you make the story about something's wrong with me.
Yeah.
that makes me think about how within kind of our traumatic experiences, we choose connection over authenticity. So when there's a threat to being connected to our primary caretaker, and the threat is we can't be who we are and we can't feel comfortable or be seen as who we are, we're going to choose staying connected, and we're going to disconnect from ourselves and not be authentic. And that can be traumatic, especially as it comes out kind of in our life as adults. So yeah, I think with my trauma sensitive approach in helping my clients, it's really about helping them understand how and why they're triggered or activated today, and then how they react or respond to that trigger, and recognizing that there's learned coping strategies and mechanisms that are in place from their history. Right. So whether it's going to food and emotionally eating or binging or restricting, or it's body preoccupation, or it's any number of things, drugs, alcohol, social media, people pleasing, work. These are learned coping mechanisms. We can know cognitively they're not serving us, but we're not making changes and healing at the cognitive level only. We're healing at the emotional level and at the nervous system level. So this trauma sensitive lens is helping us to recognize that our reaction and reactivity is our nervous system responding to something old. That's we're reminded of in present day situation or interactions with people. So one example I was thinking of, like if you were yelled at as a kid and you dealt with verbal abuse in your life today as an adult, maybe at work, maybe you have a boss who is really short-tempered, gets frustrated, sends curt emails, you may be hyper vigilant to that or super sensitive to that. And that may be triggering for you, but you're actually safe, unless it's a toxic work environment. So that would be a whole other issue. But in reality, you're probably physically safe, but your nervous system doesn't feel safe because of unprocessed and unresolved emotions from the past. So really helping my clients identify and process those experiences from the past and see how they come up for them today. And recognizing that when they turn to food or body, those are symptoms. They're providing them an outlet. Even though they don't feel like they serve them, they're providing an outlet. And so if we can have this lens, even to give ourselves a trauma sensitive lens, not just for you and me as providers or practitioners, have this trauma sensitive lens for ourselves, we can then help to reduce the shame and increase the compassion and empathy for our experience and how we've been able to survive it and cope with it.
Yeah, absolutely. Yeah, I feel very deeply all those things that you just shared, and how it's showing up in my world is really teaching people to have like awareness and access of that from the body place, right? It's just like they will come in with a pain pattern, and it's not like a textbook biomechanical pain pattern, right? And once I realize that, then we start having like different discussions. Like for example, it's like I have a patient that when she is triggered, her right shoulder hurts. And so it was like through our work, we realized it's like, hey, like there's nothing structurally happening here. Like, sure, we can do a little strengthening on the supraspinatus. Like that's always helpful. And when I walk in partnership and in journey with people, is like, we get to discover these things as well of like, oh, when your right shoulder hurts, you're triggered with something, right? Like what tools do you then have to navigate that? And then also like chiropractic, opens things up and people start feeling different things and being able to, again, bring it full circle of that trauma informed lens of really understanding how the body, there's a book called this, like the body keeps score.
Exactly.
And the body does keep score, and especially the fascial system. So I'm very fascinated with fascia because we are just starting to learn and understand how fascia, which is connective tissue that connects multiple parts of your bodies. Like, for example, you have a fascial line that connects one shoulder to the opposite hip,
Mm.
how fascia molds around emotional trauma, right? And how it literally stores in the fascia, and how we are starting to learn to have access to that. And then also for me to have the awareness of okay, we're opening up a physical holding pattern. Like, I want to give you a heads up of what to expect. I want you to have these tools. I want you to have these resources if it gets to a certain point that you feel like you need support. And I think just the power of holding space and recognizing that we've all been through, like, the pandemic was a collective trauma, right? And as we've talked about, it was a trauma that was not a traditional trauma, like bell curve, right? We usually have trauma and then it comes back down. And the pandemic was like, ooh, I'm not
Ongoing.
safe, I'm not safe, I'm not safe, I'm not safe, I'm not safe. Maybe we're safe. No, we're not safe
Nope.
yet, And so what I'm expecting is the next 3 to 5 years for us to have some residuals of an entire globe that had their safety violated by so many unknowns. And to just, again, have that awareness. I'm so grateful to have that awareness and the language and the tools to help people navigate that. Because the other thing that I always tell my patients is your body's ability to heal physically, mentally, emotionally from trauma, your body's ability to heal is far greater than anybody's that has allowed you to believe, because our bodies are just freaking walking miracles. And I hold that in the center of every interaction I have.
Yeah. Oh, I love that you just said the body's ability to heal is way more than people allow, because I think of it as our body's more resilient than our mind sometimes allows it to be.
Yeah. Yep. It doesn't mean
Yeah.
it's easy. I always joke around and I say, healing ain't for sissies. Like, it's not the easiest path, but wow, is it fruitful and rewarding.
And let's be clear too, healing, when we open up, we're talking both physically and emotionally, it can feel worse, not better.
Oh yeah.
It can feel like we're wrong, we're doing it wrong, like something's got to be off if we're feeling worse, but it's because we are sensitizing ourselves. We are becoming more sensitive to and more aware and tuned in and connected to everything that's coming up. It's not that it wasn't there before, it's just that it was repressed and suppressed, both. And so that needs to be clear, that healing is very much winding, and it can feel worse before it feels better, and before we feel more capacity or gain more capacity in the tools to sit with it or to process it in the right ways.
100%. Yeah, it's definitely not linear. And I find that we have expansion and contraction. Expansion, like, we can't always be expanding, right? Like, people will have a big breakthrough and then they'll come back to a pattern, and it's like, okay, see it, and then we're going to expand a little more. And also, like, the safety and permission for aftercare after a big breakthrough, right? Like, I just recently learned that, and how important that is, to give ourselves space for that.
Absolutely. Yeah. And that expansion and contraction brings up a point with my clients often say, like, I thought I was done with that. I thought I wasn't dealing with this food thing anymore, but it's coming up. And because there's something going on in their life, whether they change jobs, or something's going on in their relationship, or they had a big move, or they get pregnant, or they are postpartum, or they're in menopause. Like, there are different phases in our life that can bring up old things. And
definitely,
I remind my clients that it's important and it's healing to be a new person or have a new perspective revisiting something old.
Yes.
And so that contraction isn't even a bad thing, even though we think of contraction as bad. But
it's just part of the journey. Yeah. And again, it's just that I think we're so have such a black and white, like, everything is so black and white, right? And healing is in the gray. Like, there is no blueprint that we can give people for, this is what your healing journey is going to look like. You're going to go to A and then B and then C. It's just like having, like, again, holding space for the in between, the black and white.
The in between. Yeah. I love the topic of the in between. I just wrote a blog post on that, because that's everything in the healing process. To have patience with that process and being in suspension. in between two places.
Yeah, that's a beautiful
So,
analogy. Yeah.
yeah. Well, I have one more question about the trauma sensitive approach.
Yeah.
Maybe you answered it, but if you could just summarize, if you do feel like you answered it, how would you like your patients to show up for themselves with this trauma sensitive lens? Recognizing that there's a lot of different types of trauma. We may not identify as someone who's gone through trauma, but the way I described the varying types of trauma, and then the fact that you talked about the pandemic as well. Most of us have had trauma in our lives.
Yeah.
So how would you suggest your patients take on a more sensitive lens for themselves?
I think just showing up as you are. You know what I mean? Like a lot of times people will come in apologizing, like, oh, I've just had a rough day. Like I'm just a little aggravated. I'm sorry. Like, I'm sorry. And I'm just like, these are the feelings and emotions you're having right now. Like show up as you are, especially again, like, not to our male counterparts out there, like definitely appreciate you. But what I resonate with is like, as a woman, I feel like I had to go through a deprogramming of I have to be palpable, and I have to have a smile on my face, and everything has to be fine.
Yeah.
And I think, I want to give people permission that it doesn't have to be fine. And you are worthy of receiving, even when you're not fine, even when you're being difficult, even when you don't want to keep a smile on your face. So showing up as you are with curiosity and compassion, rather than looking to, and again, this is a learned skill, but I guess a willingness to not turn it against yourself. It's like that. I see people self-sabotage all the time. And I just, was learning from a psychologist last week about like our hierarchy of needs. Like if, we're going up our hierarchy of needs and we're reaching our goals and we're having a great time, like what throws us back down to the bottom of that pyramid is like a lack of belonging. And I find that belonging is oftentimes a relationship with ourselves. So being able to show up with, this is just how Sydney is today. And this is just how a patient is today. And knowing that that's in my office, like that's welcomed and encouraged.
Mm-hmm. That's really well said. And that belonging is always coming back to ourselves and feeling like we have that acceptance and empathy for ourselves first.
Yeah.
Even though we want it and need it to some degree from others, it has to be within ourselves as well.
It has to,
because we are in relationship with ourselves. Yeah.
Yeah.
Okay, I love that. So to wrap this up, I am curious if there's anything else that you want to share in terms of, if people are wanting to support themselves better or wanting to work with you or a chiropractor in their area. Is there anything else you want them to know as they're thinking about this work?
Yeah, I always describe like a relationship with a chiropractor is like finding the right mechanic, right? Like just because you didn't resonate with the mechanic doesn't mean your car doesn't need to tune up. So being willing to kind of like interview, and I think that this is for like any body worker, not just chiropractic, being able to check in and feel like you have a connection with that person, right? Like, and listening to your body of like, do you feel safe with this person? And I think that if people want to work with me, my website is thriviahealth.com, and I have some free resources up on my website too. Again, I'm just like a geek and I like to just share information with people. And I think it's just there are more chiropractors out there getting educated and understanding this trauma-informed lens. And that's just a valid question to ask somebody, like, do you have any education in a trauma-sensitive education around how you engage with the body? And I think the answer to that question will probably give you a lot. But it is such a powerful medicine that I feel grateful for every day to be able to participate with.
And I'm grateful that you are present and giving your gifts to the world of at least Marin County in the Bay Area. it's been life-changing for me as you know, I had chronic situations and they're no longer chronic, which is such a relief and a
Yeah.
huge game changer. So thank you for all that you do. And I will put your information as well in the description box below.
Awesome.
Too.
Yeah, I appreciate that. Yeah, just happy to be a resource. If anybody has questions, feel free to reach out.
Okay, great. Thank you.
Thank you, Katie.
Take care.